questions and the questions that me and Rishit came up with first, and then we'll move
Sure,
on to the chat questions. So
sure.
today we have Dr. Agarwal with us. He's going to be doing our internal medicine workshop and answering all of our questions. So first off, thank you so much for being here.
You're welcome. My pleasure.
Yeah, of course. So let's get started. So the first question we have for you is, what does your average day look like as a doctor?
See, most of the doctors, I start work at 7 o'clock and we work from 7 to 5. And the place where I work, we require to put in 40 hours a week. So what we have decided at our workplace is we work only 4 days. We work from 7 to 5 and get done at 5. We get done little earlier than 5, and then just rest of the time is just winding up. So that makes a huge difference in the quality of life working 4 days. Well, not all internal medicine doctors are able to do that. And most of the work hours stretch up to 8 hours, the normal office hours. And then they have to finish up the charts and everything that takes up to 1.5, 2 hours. So average day is about 10 hours. And generally starting time is 8 to 5. Most people get done and take a break for lunch, half an hour, and in between coffee breaks 2 times, 15, 20 minutes each.
Yeah, so we heard that you work in a prison, right, as a
Correct.
doctor.
Yes, that's
So can
correct.
you talk to us a little bit about like your life over there and how exactly you treat patients and what all goes on there?
Yes, the life in prison is different, and we treat some of the most underprivileged patient population, and there is a lot of healthcare need in prisons because most of the inmates are there. They have not had healthcare for a number of years because of socioeconomic conditions, because of lack of services, or what we call they are in those places where access to healthcare is denied. So we do see patients, like we have young patients with high blood pressure who end up with kidney failure because their blood pressures have remained high for such a long time, untreated hypertension that has led to kidney failure. So those kind of things you will see in the prison patient population. The other thing is there's a lot of mental health disorders. 64% of our patient population has mental health diagnosis. So it is very important that we understand how we work with the patient rather than what we have as an agenda that, hey, you need to do this. That will not work. You have to work with the patients and ask them, find out what is causing them not to take the advice or not to follow. Because there are a lot of barriers to getting treatments. So, in a way, prison, what we call is correctional medicine, is slightly different than medicine practiced outside.
Yeah, thank you. That was really helpful. So what path did you take to become a doctor, like the doctor you are today? And what are some obstacles you faced? Say we go all the way back to high school when you started getting interested in this field. How was
Right.
your path to get to where you are today?
See, I did my high school and medical school from India, so it's slightly different than what you all will be doing it over here. But I can tell you from example of my daughter how things are. In high school, I was interested, and then in India, of course, in we have the 10+2 system. In the 12th, you take science subjects, and you have to have biology as a major, and then we straight away go to medical college after 12th grade. So it's slightly different. But here, following my daughter's, she was in pre-med. You have to be a pre-med over here, and there are specific subjects you have to take. And one of the downside of pre-med over here is you got to have some hours of calculus, which overall I don't think is much helpful. But yes, it does give you a broader understanding of different sciences. So after the pre-med, then you have to take the MCAT. I'm sure you all know about that. And then depending on the score in MCAT and the state where you are, because see, in the state of California, the population it serves, the total population is about 50 million, and the number of medical schools in California are much less compared to any student in state of West Virginia. where the population is significantly lower, but the number of medical school seats available are much higher. So here, a lot of students from California go to other states, like Arizona has a lot of medical schools where California students take up those places. And then that's all I can tell you about. So most important thing I would say is that having an interest and wanting to be a physician.
Hmm. So if we keep thinking about interests, what actually inspired you to become a doctor?
In my case, I was going to hospitals right from my early childhood. Like when I was in school, I used to go and volunteer at the hospitals and write letters to for patients. Like patients, a lot of patients, they don't have the resources or they don't have the education, and I would write letters to them, to their family, because in my times there were no cell phones and there was no internet, so letter was the only way of communicating. So that's how I got interested. And I wanted to be a doctor. And when my family members were admitted to the hospital, I could see the respect doctors got from the patients and the family. So that was a big inspiration for me.
Yeah, that sounds really inspirational. So, since you work in a prison, and most people when they think of doctors, they think of like a workspace in a hospital. So, how exactly is it different from treating a patients in a hospital versus treating patients in a prison?
Treating patients in a prison is different, that our patients don't go anywhere. They are there all the time. So that is one big difference. In the hospital and in the clinics, patients come from outside. They come from home, they come to your clinic, or they come to the hospital. So that is one major difference. Second is, as I said earlier, the healthcare needs are different. Because we treat chronic condition, most of our patients have, like patients anywhere else, have diabetes, high blood pressure, but the factors which impact the disease are different. Like in the outside setting, you may be able to prescribe certain exercises. Our patient population will not have the same kind of resources. Like diets in the prison, diet is pretty much fixed, and those kind of modifications are not available to patients, inmates in the prison. The other thing is that they live in a activity group thing, so certain infectious diseases, like especially during this time COVID, it's very prevalent in prison because all the social distancing, all the putting on, of course masks are mandatory now, but the social distancing is not always possible in a prison setting. So infectious diseases have much more chances of spreading in a prison setting. So correctional medicine has become a specialty by itself now. It's different. And again, as I said earlier, they are the underserved, underprivileged. And at the other end of the spectrum is sometimes patients feel very privileged. For any back pain, they say, oh, I need an MRI. So then it is our job to evaluate them and tell them, no, you don't really need an MRI. What you need is just try these medications. I can send you for physical therapy for your back pain, and we'll see. MRI is required. Further investigation is required only if these things don't work and if there is something more serious going on, which we will know from evaluation. So those
Okay, cool.
ways,
Sorry, go ahead.
so these ways it is different.
Okay, so someone in the pre-submitted questions asked, since you work in a prison, do you ever feel intimidated because you're treating prisoners?
I would say no, but then the other thing is that anywhere you go, you have to be on your watch. Like you cannot let your guard down, as they say. We got to have our correctional awareness on all the time. Like these are our patients are not regular human beings. They are all convicted felons, and they have mental health problems. They have anger management issues. And the thing is, what we learn is, over a period of time, that certain encounters can get hot because a patient feels that he should get this treatment, and I feel that no, he cannot get this treatment. He does not need a certain special medication or certain special privilege. Like, so then that kind of an encounter can get out of control very quickly. There will be an anger management issues, and he will get angry when they feel that they have not been provided care. They feel that I'm depriving them of the care they need or the treatment they need. And sometimes they are angry against the system, and that anger can manifest on the physician. So we always have to be on our guard, and we can always stop an encounter and tell them, no, I'm done with you. You're good to go, and please leave. And we have correctional officers, the guards, and we can call them if an encounter goes not as intended and it becomes acrimonious. We can always tell them, you go and call the officer, and hey, officer, take him away. I'm done with him. So, but overall, what has been observed is the incident of physical on nursing staff or medical staff is much less in the prison setting because the inmates are there. They have the guards over there all the time. And these are more likely to happen in the ER when psychotic patients or patients who are really angry against whatever anger they have against the medical system for their disease, they're much more likely to attack. More attacks have happened on healthcare providers in the emergency room setting than in the prison setting. So one shouldn't really feel that way. But yes, you have to have your guard on all the time. You have to be having your awareness. So that way it's different.
Yeah, to follow this up, this is an interesting question. What is the most bizarre thing that has ever happened to you at work since you work in a prison?
Oh, yes. See, if, one incident I can tell you is how patients are different because, there is a lot of drug abuse in the prisons, and the prisons try to control the flow of drugs. And I had a patient who had a diagnosis of cancer, and he was on morphine, one of the opioids. And because of his pain, he used to get medicine we used to give him because he's suffering from pain. But this patient, we found out, was selling medicine to other inmates. And that was at times, so like he got mad that why am I not giving him the medicine that he needed? Well, then I found out, and I had to confront him that, hey, you're selling this medicine, you're not taking it for yourself. So that was the first time I had to, we are given a whistle, and we have a, what you call, an alarm. I had to set the alarm off, and the guards came in quickly because the argument was getting acrimonious, and I had to stop the visit there. And then I said, I'm done with you. Please go. And he was not leaving. So I had to call the guards in. That was the most bizarre incident I can say.
Yeah, that was really interesting. Okay, so now let's talk about internal medicine in general. How has COVID affected like doctors around the world and specifically you at your job?
So COVID has affected in a big way the whole practice of medicine. Uh, we are not doing a physical exam right now because the whole thing what we're doing is like everywhere else, like in all other industries, what is most important? We are assessing patients. Okay, do I really need to examine him? Do I need to listen, auscultate, or listen to his lungs, or listen to his heartbeats? What is the information I'm looking for? And if it is not required, I'm not going to do it. So that is one big thing, which is the patient care, the whole model of patient care, like previously examine, do everything. No, that has changed. That is one big way. Then second is we have to take the precaution. We have to maintain a social distance, keep washing hands, wear the PPE, the masks, and the face shield. Because now it is mandatory for all physicians. I'm seeing patients, even though I'm not examining them, I'm talking to them. We try to do it at a 6 feet distance, and we put on the mask and the face shield. And if a patient has been tested positive, then we put on the whole PPE. So that is one way.
Okay, thanks for that. And now we have another question. What opportunities about the medical field can you suggest to the students who are listening today to this workshop?
Opportunities are plenty. So that will depend. Internal medicine will be done after you're done with your medical school, and then you're applying for residency. Then you have to make a selection depending on what scores you get on the USMLE. And internal medicine is generally available. It's one of the primary care, what we call, is the basic block of medical practice in the US. So all doctors, all patient, everybody needs to have a primary care doctor, and he's your first contact to the healthcare system, your primary care doctor. So if you have a condition, depending on your insurance, your doctor will refer you to the other specialist. So as a primary care doctor, you have a wide, you got to have a knowledge of various specialties, basic knowledge. And in my practice, the places where I have been, I refer to specialists only if they need an intervention. Like if I need to send a patient for cardiac cath or an echocardiogram, or the disease is such that I need a specialist opinion. Otherwise, as a primary care doctor, you are able to manage most of the conditions by yourself if you have the confidence, if you have the training. So you get that kind of satisfaction.
Yeah,
So that
okay.
is how
Oh,
primary
sorry, go
care is
ahead.
different.
Okay, cool. Now I'm gonna do some questions from the chat that our audience
Sure.
asked. So one of the questions was, is the Indian medical school environment very cutthroat? Like, is it very competitive?
I think so, yes. It is very competitive. And what is happening in India is a lot of physicians from India or young physicians are planning to come to the US, and it's become very competitive over here. So everywhere, medical schools are very competitive. Yes, I totally agree.
Cool. Another person asked, what exactly is internal medicine?
Yes, that's a good question. Internal medicine is all adult medicine. So except pediatrics up to the age of 18, and we treat all adults from 18 onwards to any age. I had patients of 106 years old. So provide them overall healthcare, like treat all diseases. That first is uh, when a patient has any symptoms, we try to assess what is their diagnosis, and we first take a proper history, then do a physical examination if need be, and now in COVID cases, do a very focused exam, as I said earlier, examine them only if they have a respiratory symptoms, or if I think that I'll get some useful information listening to their lungs or their heart, and then do proper tests, either lab tests or radiological investigations, X-ray or a CT scan or a MRI, depending on what I think is the diagnosis and what information I'm looking for. Arrive at a diagnosis, or even without these tests, I can arrive at a diagnosis based on my knowledge and the patient's evaluation, and start them on treatment, and tell them, hey, this is do patient education. I think you have pneumonia. I think your blood pressure is high. You need to take these medications, and give them a plan that what will happen if you don't get your blood pressure treated, what will happen, what can happen if you don't get your diabetes under control. So that is what primary care doctors do. Or like patient having cough and shortness of breath and fever, then get an x-ray and see if it is pneumonia, and then give them antibiotics for pneumonia. Or if their condition is bad, like if their oxygen saturations are low, or if they're not stable, then send them to the hospital for intravenous antibiotics. So those are the things what primary care doctors do. And then
Okay.
patients go to specialists, like they've seen their, after a heart attack, they've seen their cardiologist, then they come back to the primary care doctor, follow up with the primary care doctor for their blood pressure checks and make sure that everything is staying stable. Or after a stroke, come back to the primary care doctor. So that is what internal medicine doctors do.
Cool, thank you. I think that was really insightful. So in the chat, someone else asked, why did you choose to work in a prison? And a similar question was, Are there any special qualifications you need to work in a prison?
Why I chose is when I was in Alabama and I wanted to come to California. And then the first job that was available in California was in a prison. And I had never had an exposure to working in a prison before. And then I liked the lifestyle, and I saw that I could do very important work to a very underserved patient population, because I had diagnosed conditions, a patient who's never had a colonoscopy, and I got a colonoscopy done, and we found that he has a cancer, early diagnosis of cancer. So he was so grateful. There's another patient who had a high blood pressure and his kidney function was going down. So we controlled his blood pressure and his kidney function improved. So that is the kind of satisfaction you get working in a prison. We had patients who were having chronic cough and we gave them antibiotics, and then we got their x-ray done. X-ray was fine. We treated the pneumonia, but their cough didn't go away. We got a CT scan done and found out that he had a cancer. So those are the kind of diagnoses you make in the patient population, and a valuable input you can provide, medical advice you can provide. And now, of course, it is the lifestyle, because working 4 days makes a huge impact in quality of life. Plus, emergencies are limited. Our work hours are like the advertisement given up by my job is any physician who can attend his son's football games. So that is the kind of lifestyle prison medicine offers. So that is the reason, and the pay is good. Life is Work is good. The work-life balance is excellent.
That sounds pretty cool. Okay, someone else also asked, what happens when the patient doesn't want to do something that's important? Like, what if they completely refuse to take a medication or they refuse to get treatment?
That happens very commonly because there is a lot of distrust of the system, and we as a physician try to make sure that what is the reason. We try to talk to them that, hey, what's going on? And sometimes they tell us, sometimes they don't believe in the system, they don't believe in taking medicines. Then we have to explain to them, document everything. And because they are adults and they have decision making capacity, we have to agree and say, okay, we'll wait. And maybe sometime later, you might want to rethink your refusal to take medication or refusal to take treatment. And what you have to work with the patients. There's no one way or the right way or my way. What works is what is most effective. So, yes, patients have died because of refusal of treatment. But then, hey, that's all we could have done. We could not have forced treatment on them unless they have a mental health condition or they have a court order where we can force them to have their medications. So, all those adults who have a decision making capacity, who can think for themselves, they have the right to refuse any kind of treatment.
Okay, so we have another question from the chat. Do all
Mhm.
prisoners get to pay for the treatment? Like, do they have to pay, or is it, or do they, or is it like paid for by the government?
Everything is paid by the government. The only place in the US where healthcare is guaranteed is a right is in the prison system. The constitution of the country provides free healthcare to all inmates, all prisoners everywhere in the country. So they don't pay for anything, no services, absolutely. Everything is paid for. Our taxpayer dollars are working,
That's
providing healthcare.
interesting. Yeah, I didn't know that. That's interesting. Wait, someone else also asked in the chat, have you ever regretted working in a prison?
No, in my case, but I can see there will be days when you have a lot of patients, and our patients are sometimes not the most respectful because they have been in that background. They have come out of such education, their home situation, their family situation, where respect of authority is not always their prime, this is not their priority. So you can have patients abuse you at times. they will not follow your advice is fine, but then you have to have that kind of maturity, understanding that, hey, he's angry not against me as a person, it's against the system. He does not trust me, not me as an individual, but he doesn't trust the system, the healthcare system or the medical system. So there will be, if you have more than one such patient, if you don't really have confidence in what you're doing and why you're doing, you can feel that way, yes, that, hey, am I working over here? I'm trying my best. But there are good days where after multiple attempts, you are able to convince a patient, you are able to work with the patient, and he feels that no, the advice you have been giving is really helpful. And those are the days where you really feel good. Like there was a patient, and he had been smoking for 20 years. And the first time I saw him, I told him, hey, you need to stop smoking. Of course, now prison smoking is not allowed. And next time he comes and tells me, doc, what you told me, I thought about it. And you know what? I've stopped smoking. So those are the kind of advice sometimes you give. And the way you convey that message, that makes your day. That, okay, I did really help him to make a decision that changes lifestyle, because that smoking is going to have the biggest impact on his health.
Mm-hmm.
So that is the kind of
Yeah.
satisfaction sometimes you get.
Yeah, to follow that up, someone asked, what is the best moment you've had when you were working in like treating patients in the prison? Like maybe your favorite moment you can recall.
Oh, I can tell you one example. I was working in the Santa Clara County Prison. I used to work in the women's cell. And outside my clinic, there was once a huge commotion, huge crying and laughing and noise going on. So in the waiting room. So I went out and saw what was going on. And there a mom and a daughter had reunited after many, many years, after 5, 7, 10 years, we don't know. They were reunited in the prison, in the waiting room of my clinic. And there was cheer and joy. So those kind of incidents also happen. So that is one I'll always remember and cherish, or remember at least.
Yeah, that sounds like a great moment. Someone else in the chat asked, why did you do internal medicine in contrast to pediatrics?
My first choice was general surgery. I was a general surgeon in India, and I worked in Africa as a general surgeon. When I came over here, general surgery residency was 5 years doing the same thing. In training, is you are just given the lowest work, and I didn't want to do that. And internal medicine, you can treat a large number of diseases. It's very interesting that way. You get an insight into patient and their overall health. So pediatrics is limited. And in the US, when I was doing choosing residency, it was different. The moms, pediatric care depended on how educated the mother of the child is. And you don't have any impact on that. You cannot influence. You have to work with the moms, and depending on their education and how much care they take of your patient, everything depends. So I didn't want to do that. I didn't want to go that route where my patients suffer because of other factors rather than good healthcare, because there's a lot of social factors involved in pediatric care. In internal medicine, it was different. It is different. So I chose to do internal medicine.
Yeah. Okay, so one other person in the chat asked, have you ever formed a bond or became friends with any of your patients?
In the workplace I am now, we cannot form bonds. But yes, we do form bonds. We do, they wish me well. We wish each other well. But I'll give you an example sometimes how bonds and these things. When I was in India, I had a patient and he had so much belief in me, and that sometimes it hurts. That he had a, I was in city of Surat where I had operated this patient for I don't remember what condition, and then he had developed so much trust. When I moved to Ahmedabad, it was the capital of Gujarat, a different city. So this patient would call me for advice. And once he had a chest pain, and I told him, go to the hospital. He said, no, I trust you. and I will come to you, sir, you get me treated over there in Ahmedabad. So yes, you do form bonds, and then there was a different outcome. So yes, you do form bonds, and it does impact patient care.
Yeah. Okay, so we have another question. With years of experience in the medical field, what advice can you give students listening today so they can someday venture into the field as well?
The advice I would give is follow your heart. If you want to be a physician, you'll come across a lot of barriers, and to be a physician, it's more important is desire. Most important is desire, and if you have it in you, fire in your belly, what I would call, that is most important. You will be able to do it. There will be failures, there will be a lot of hardships, but there at the same time there's a lot of joy, there is a lot of satisfaction, and this sense of belonging, this sense of service, sense of doing, and that you will achieve, which I can say that I have that now. But I wanted to do this, and I'm happy where I am, and if I have to do it again, I do it the same way.
Okay, cool. So someone in the chat asked, could you talk about like all the types of patients you've treated, like maybe the different categories?
Oh, the different categories. I treat patients of high blood pressure, diabetes, asthma, COPD, thyroid disorders, prostate problems. I manage patients with the specialist of different diseases like cancer, rheumatology problems like arthritis, rheumatoid arthritis, kidney failure, all kinds of patients.
Yeah, okay, we have one other question in the chat.
Sure.
Do ethics play a important role in your job, or is it all based off the system?
Most of it is based on systems, but ethics play a role in I talk to the patients and see there's a lot of, especially at the end of life care, there is a lot of misunderstanding, and it's not that much of ethics as much as making them understand what is involved when they have reached the stage when the disease is overpowering and their desire to live, their desire to continue living or get all treatments, and the futility of treatment. So there, depending on the trust they have and trust you have built up in the patient, much depends on that. Because if you as a physician say that, hey, this is not working and this is not going to work, and the side effects of the treatment, or the it is this treatment for the cancer is going to prolong your life only by few months, and right now the side effects of the treatment are so great that you're not able to eat, you're not able to, you're having vomiting all the time, you're having these symptoms, you're suffering right now. So not that much of ethics, but the trust. And I'm able to convince patients, hey, let's stop this treatment, it's not helping you. So let's change your code status, make you do not resuscitate, just have a comfort care treatment rather than the curative treatment. So in those situations, yes. I don't know if I've answered the question correctly.
No, I think that was a great answer, yeah. And our last question that we have is, what is the most stressful situation you've dealt with at work? And since doctors usually have to deal with a lot of pressure, how do you cope with this sort of stress and pressure?
Stress and pressure is depend on how you take it. I would say that there is always stress and there will always be pressure, especially in the hospital situations if you're working in the ICU, and especially in these times, COVID times, there will be a lot of patients where you have to make life and death decisions. You'll face a lot of situations, death situations. So those are very stressful conditions. And my way of dealing with is that you got to have very high internal set point that it does not affect you personally, and you work from a very high set point that yes, this is what medicine is, and you are going to do your best, you're going to give them the best advice, do the best treatments, and you don't control the outcomes. What we can do is just provide the treatments. The outcome is depend not on us, and there will be bad outcomes. So, and you got to have a life outside the hospital. As a your personality has to be such that you are engaged in a lot of other things, reading, hiking, doing something creative besides work, like people do cooking, listening to music, reading. So that is very important, that you have a life, you have kind of right work life balance, because there will always be stress at work.
Cool, thank you. I think this just about wraps up our workshop for today. This is the end of this AMA. Thank you, Dr. Agarwal, so much for joining us
Thank
and
you, Mahi.
teaching us
Thank you,
lots of new
Rishit.
things.
Thank you,
Would you
Rishit.
like to
Thank you,
say anything
Mahir.
final to everyone?
Yes, I wish them all good luck. And if you have the desire, you have to work hard. There's a lot of hard work, but the good news is that there's not that much of intelligence. So if you're persistent, you will be able to make it in medicine. So be persistent, devote yourself, and go for it if you want to do it. And the rewards are immense. The respect you get paid. You are never worried about losing your job. There will always be a requirement of physicians. And one thing I can tell everybody, that you can work wherever you want. You can place a finger on the map that I want to go and work in New York City, I want to work in San Francisco. You'll be able to find a job as a physician.
Thank you. Yeah, thank you. Those are some great words of advice. Thank you,
Good
everyone,
luck.
for joining us. And thank you, Dr. Agarwal, for taking time out of your
Thank
day.
you. Thank you. Bye bye. Good luck.
Hey, thanks.
So I'm going
So
to
we'll
sign
see you
off
guys.
now. Yeah. Bye
Yeah,
bye.
sure. Everyone, you guys are free to sign off, and we'll see you in our next workshop, which starts at 4:15. That's the biotechnology workshop. So we hope to see you there, and thanks for joining us.
Bye bye.